We know that ADHD runs in families and have for 40 years. Here are the risks if you have an ADHD child. 25 to 35% of their brothers and sisters will have the same disorder. If you're an identical twin, that risk is 78 to 92%. Notice that the closer people are genetically related, the higher the risk if one has the disorder that the other's going to have the disorder. Now, if we bring in their mothers and evaluate them, upwards of 1/5 of their mothers are still adults with ADHD, and nearly 1/3 of their fathers are currently ADHD. And if you add those two together, it means that there's a 50% chance that one of the parents sitting across your desk has the same disorder, probably never diagnosed, which is why we now teach clinicians that you should be screening every parent that brings a child to your clinic. If you're an adult with ADHD, 40 to 54% of your children will have the same disorder. That is a profoundly genetic disorder. Nearly half of the offspring of adults with ADHD have ADHD as well. We know from twin studies that the vast majority of ADHD is due to genetic differences. On average, 80% of the differences in people in this room in their ADHD symptoms are due to differences in their genes. And in the last few studies, it was as high as human height, about 91%. Twin studies allow us to calculate how much of a trait is due to the rearing environment, and it's 0. All 40 twin studies published in the last 20 years have shown that the rearing environment has no influence on this trait. Yet the public believes that ADHD originates in bad parenting.